But I want to bring in Reggie Cicchini with this developing news. Reggie, Reggie's in Washington for us. Who inside the White House do we know is tested positive now for coronavirus?
Hi, Farah. We're getting a note from the White House that it is a personal valet to the president. The valets are kind of an elite military unit that work very closely alongside the president and the president's family members. And the note from the White House essentially says, we were recently notified that a member of the United States military who works on the campus has tested positive for the coronavirus. The president and the vice president have since tested negative for the virus, and they remain in great health. But this does raise questions and concerns, given that we know how long it takes for this virus to incubate inside the body, and that you can test negative one day but potentially still have that virus inside of you. It's worth noting the president was just on a trip in Arizona earlier this week, touring a mask at the Honeywell facility where he wasn't wearing a mask. There were no people around him wearing a face covering either. So this is kind of raising questions and concerns inside the White House that the president's health could potentially be put at risk here. But it's also raising questions given the fact that the president and vice president often work very closely with each other. What would be to happen if both of them were to fall ill? These are things that we're following right now.
Yeah, I imagine. Speaking of Arizona and other states, there are several that are reopening despite failing to meet guidelines set out by the White House. Talk us through that and where.
Well, so the CDC and the White House had put these guidelines out a month ago that had a number of different criteria that you had to meet in each of these three phases just to be able to reopen the very beginnings of your economies. No states have even come close to step one for phase one. That was the gated criteria that showed a 14-day downward trend in reported cases and an ability for hospitals to be treating patients at pre-pandemic levels. At least 10 states haven't come close to that right now, yet we have 43 states by the end of this coming weekend that will either be partially opened or fully reopened and have relaxed most of their stay-at-home or safer-at-home orders. And this is a growing health concern now, and a growing concern for health experts and for epidemiologists who say that given the number of daily confirmed cases across the country right now, which average around 25,000, this allows for an increased possibility for this virus to continue to spread as we see people cramming onto beaches and packing small businesses around the country. The average death toll right now in the U.S. Sits between 2,000 and 2,500, and models just earlier this week had predicted that we could be reaching a death toll of 3,000 per day by June, and that's where the fear for these health experts come, that if more people start to gather around each other as these states reopen, we run the risk of seeing these models actually come true far earlier than they were expected to.
Especially if the testing isn't there, right? Especially if the testing, the contact tracing, if that's all not there as it should be, that's the big concern. Now, we've seen President Trump shift his task force, so to speak, from the coronavirus and from the health angle to the economic angle, and that's why we're seeing states reopen. And there are new job numbers today just to show us what the economy is like right now in the United States. What's the latest, Reggie?
Yeah, so the weekly jobs report out today shows that 3.2 million, or just about 3.2 million Americans filed for first-time unemployment claims last week. Tomorrow's jobs report for April will show roughly 20 million Americans out of work for the month. But since March now, we're looking at roughly 33 or 34 million Americans who have lost their job because of the COVID-19 outbreak around the U.S. That works out to about 90% of the population of Canada without a job right now. And this is a part of that real push and that broad shift in messaging when it comes to the White House and the changing roster of their task force in order to focus on the economy, because the president can't ride a message of medical advice when there's a consistent and persistent push that reopening economies is simply going to do more harm. The president needs to be able to say that he's taking any opportunity he can to build things up. There is a growing push, a growing surge of Americans who have been protesting outside of state capitals, trying to get their governors to reopen economies. That's why we're seeing this increased push within the Trump administration. But the president as well simply says that he doesn't want to see the country locked down for years. That was never going to be a possibility down here. But epidemiologists and health experts, including Dr. Birx and Dr. Fauci, have been saying for weeks now, if you go too quickly, there is a risk that those economies will have to shut down a second time again, throwing potentially millions of more people out of work. But also, that's going to cost states that are already losing billions of dollars right now in lost income and lost revenue with the amount of businesses that are closed. And we're hearing that state budgets are so tight right now that there are going to be hundreds of millions of dollars cut to education within the next couple of months before kids even go back to school, if kids are able to go back to school. This is a virus that still has a lot of confusion left to it, and that simply is being kind of expanded on right now by the fact that the president is pushing for an economic recovery, despite the fact that there is no health recovery yet.
Reggie, let's focus on one specific state, and that's New York City. There's a report that links outbreaks across the U.S. To not a state, to a city, to New York City.
Yeah, so geneticists have seen that New York City really is a cause of the spread around the country. There were outbreaks across Louisiana and Florida and Georgia, along with Arizona and some states along the West Coast, where they've been able to trace the origins of the virus or the outbreaks in those states back to New York City. And that's simply because at the very beginning of this outbreak, state leaders were simply too slow to act to be able to stop the spread. So given the fact that New York was such a hotspot on this, with the virus being able to be traced back to Europe and eventually traced back to China, they say that because of that slow action, the virus spread significantly faster than it would have if there were measures in place. Now, that's not to say that Washington State didn't also play a role in this. That initial outbreak in Seattle did get traced to outbreaks in about a half a dozen other states, and we know that Washington's original outbreak kind of was on a skip-stop journey from Wuhan province right into America. But it is worth noting here that geneticists and health experts say even if New York had locked itself down earlier, the virus simply would have continued to spread around the United States, but possibly at a lower level. It also speaks to what epidemiologists have been saying for weeks now, is that these viruses live in silent hotspots around the country. So as we see numbers in New York continue to decline, we're seeing the rest of the country continue to push an increase in their case numbers. And that likely could be the story now for weeks, if not months to come.
And, you know, with so many crises, we see these crises that it's, you know, the vulnerable populations that are being the hardest hit. We're also seeing that across the United States. So that's something we're watching. Thanks for that, Reggie.